Hi everybody, my name is Dr. Uri Burstyn, and this lovely little creature is Claudia, the most squished cat on the internet. And we're here to deliver to you a video that you didn't know you needed about feline constipation. Before we get going, please remember to squish that subscribe button and pet the bell notification icon, like this video, and most importantly, share it with all your friends who have cats and anywhere where you know cat owners gather, because this is a very, very important video. Constipation is quite a common feline issue. It doesn't happen so much in dogs, but I think it's something every cat lover should be aware of. And also, if you appreciate my work, please come support me on Patreon and help me make more videos like this. So with that out of the way, let's talk about feline constipation. First, let's talk about what constipation is. It basically means not pooping enough. So a cat should leave you a little present in the litter box at least once a day. If they're not pooping every day, they're probably constipated. If they're not pooping every day and then the poops you find in the litter box are small and dry, then they're definitely constipated. The caveat, of course, is outdoor cats who refuse to poop indoors. That is a special kind of challenge. Like any medical issue, things get complicated very fast. But here's a rule of thumb. Constipation is caused by dehydration, and dehydration is caused by kidney disease in cats. This is true probably about 70% of the time. If you have a cat who's getting constipated, they're always dehydrated, and that's usually caused by kidney disease, so chronic kidney insufficiency. So I almost always run blood work on constipated kitties when they come into my clinic, and often we do find that to be the underlying issue. Now, of course, you can have other reasons why you're constipated. There are some obvious environmental ones. You know, if your cat's had heat stroke or has been deprived of water for 24 hours, sure, they could be dehydrated for other reasons. But most of the time, patients with normally functioning kidneys don't get dehydrated. There's a feline-only exception to this, and that is a genetic disorder that some cats get that causes idiopathic constipation leading to idiopathic megacolon. And megacolon does sound like a villain from a Transformers cartoon, but it's actually a serious health condition. And what happens in some small percentage of cats is a neuromuscular junction that interfaces between the nerves that innervate the colon and the muscle of the colon degenerates, and the colon simply doesn't get the signal to contract. And so these cats, they just don't feel the urge to poop, and they get constipated. And the way you can tell you have one of these cats is, first of all, you rule out kidney disease with a blood test. Second of all, you have a young cat who's getting constipated, or maybe an older cat who gets really, really bad constipation over and over again with their kidneys being fine and no obvious source of dehydration. So, well, this is a fairly rare issue, but you should be aware of it. But most of the time, it's underlying kidney disease. I have really become cognizant of this issue in the last few months, dealing with Mr. Pirate's kidney problems. And he's sleeping in the basket over there. We won't drag him out for this video. But I definitely spent a lot of time monitoring his bowel movements, making sure he's pooping every day, and using his stool production to tell me if he's getting clinically dehydrated, which is really important in kidney disease patients. I will drop a link to a video on feline chronic kidney disease that I made this summer into the description below, so that you guys can brush up on your kidney disease and nephrology. But just so you know, I do use bowel movements as a great way to monitor whether Mr. P is dehydrated or not. Because of course, when you have kidney disease, we always want to keep these cats really well hydrated. The other cat-specific thing that everybody should know is that cats are kind of weird. Okay, we all know that. But one of the ways in which they're weird is that cats have stretch receptors in their colon, which are linked to vomit receptors in their brain. So cats who are constipated vomit. And it is, in fact, whenever I have a vomiting cat, I always consider constipation as a possible differential, because it is quite a common presenting complaint. And often owners don't even realize their cat is constipated. But then when I ask them for a more detailed history, they're like, yeah, well, you know, we haven't seen a bowel movement for a few days in the litter box. Much better. Now, where were we? Yeah, so half the video files on this initial taping got corrupted, so I'm remaking this video after a haircut. And let's just see where we left off. Right, I was telling you guys about how weird cats are and how they vomit when they're constipated. So when one of these cats comes to the vet clinic, let's say they're vomiting. A part of our physical exam is always to feel the abdomen, and quite often when a cat is constipated, you can actually feel a colon that's full of firm stool on a physical exam, part of the skills of a veterinarian. And often we will do an x-ray, particularly if this is the first time the cat presented like that, because there's obviously many reasons why a cat could be constipated. Don't want to get into them, but let's just say an x-ray is always appropriate. And sure enough, when you have constipation, you can confirm it with radiographs. You can say how bad it is and what level of intervention is going to be needed with radiographs. And as I mentioned earlier, we usually do some blood work to check for underlying disease. And then we treat constipation with an enema. I'm not going to get into the details of what an enema is, but let's just say it is an essential tool in managing constipation. Sometimes if it's really bad, it gets a little uglier than that. We call it deobstipation, and you definitely don't need to know what's involved there other than the fact that sedation is absolutely required. And again, enema, some stool softeners to go home for a few days, usually some subcutaneous fluids. I always give subcu fluids to a cat after giving them an enema because we know that dehydration is playing a role in this, and subcu fluids are a really quick and easy way to rehydrate a cat. And then we just wait for the blood work to come back and assess for underlying causes. So that's what you have to know about the diagnosis of constipation, and then also a little bit about the management. And again, sometimes it's just a one-off thing. Sometimes we find an underlying cause that needs to be managed. Diet definitely plays a role in these, particularly if we find a cat who's getting constipated regularly but does not have like kidney disease or another good reason to get dehydrated. Then we often manage these cats with a high fiber diet, which we have prescription clinical diets. I would recommend treating these prescription diets same as you would any drug that your veterinarian prescribes. Is just a tool to get the job done. And if that job is to have a cat who's pooping every day, then it's an invaluable tool. And definitely better than using a stool softener every day, just from a work perspective. Just less work for you, less work for the cat, better for everyone. So I hope that's most of your feline constipation questions answered. I'm sure there's plenty more, and you can always ask them in the comments below. The two things I would really like you guys to take away from this video is first, that vomiting can be a sign of constipation, and constipation can be a sign of further underlying disease. So it should be taken seriously, and it definitely warrants an investigation. Of course, it's also very uncomfortable for the cat, so it needs to be taken care of. And then if you don't take care of it fast enough, it can actually cause damage to the colon and lead to more constipation events in the future. And two is that firmness of bowel movements and regularity of bowel movements can be really useful for monitoring a cat with chronic kidney disease. That you can tell how much fluids they need and whether it's time to give them subcutaneous fluid therapy, whether you need to give more or less based on their bowel movements and their firmness and regularity. Obviously, the goal being normalcy, and normal for a cat, again, is usually one normal looking bowel movement per day, not super dry, not tiny, and not every other day. And that can really help you fine tune your kidney cat management at home, or really diabetic cats, really any cat that's prone to get dehydrated. But kidney disease and diabetes are probably the two chronic diseases that first come to mind. And yeah, it's a useful little thing to be aware of. So thank you very much for watching, and we will see you later.